Julie. It's so great to chat with you again.
Hi, Kimberly. It's good seeing you too.
Hi. On my end, I support women all over the world, pre-pregnancy, during pregnancy, and postpartum. My focus is on mind and body. So I spend a lot of time covering foods and herbs, as well as techniques such as yoga, meditation, EFT meridian tapping, just to name a few. When it comes to connective tissue, there's so much to be done, with the diet. We talk about things like nettle, and silica, cucumber juice in my world, but structurally, there is so much to look at when it comes to abdominal separation or diastasis recti. And you are the expert in this, so I just want to ask you a couple questions, if that's okay.
I would love it.
All right. Could you briefly explain what moms can look for when it comes to diastasis recti and talk a little more about what they can begin to do healing postpartum?
Okay. Well, first of all, I want you to know that most moms have it. Okay. I would say 99% of the moms have it. During the first pregnancy, it's not as noticeable. With each pregnancy, women start showing faster. So then usually they think, oh, something's wrong with this. So the best thing is that if they catch it after the first pregnancy, and even better, if they haven't been pregnancy, to learn what they can do to prevent a diastasis, because during pregnancy, the muscles can stretch without separating, and you actually can make a diastasis smaller during the pregnancy. You can't close it, but you actually can make the diastasis smaller during the pregnancy. So it's important for women to understand that this is something that is normal, all right? And diastasis is a separation of the abdominal muscles. And what happens is when the muscles separate and the connective tissue joining them stretches sideways, these outermost muscles are not doing their job anymore. And their job is to support the back and support the organs. So when they separate and the connective tissue joining them stretches sideways, it's now this stretched out weak connective tissue not effectively supporting the back, causing back and hip problems, and not effectively supporting the organs. So the organs all move forward. And if they're out of place, they're just not going to work as well.
And I can say that was actually my experience. With my first child, I felt like everything went back. My stomach was flat. With my second baby, people would think I was crazy if I said like, oh, I have this abdominal separation because my stomach is flat. But I can tell you, I feel it. And when I visited with Julie, she did tell me that I do have a 4-finger gap. Again, from the eye, you wouldn't notice it. I feel it because my back I was having lower back problems, and I could actually feel that gap when I go to sit up, that my stomach, something in there is just a lot weaker than the first time around. So that is absolutely true. And it's not just the women that think that they have this extra, it's not always that, I guess is my point.
And the other thing is that nutritionally, people will say, oh, they get bloating after eating, or they'll get the constipation. Now the bloating after eating, people say, well, maybe I have a food allergy, and it's just that when the intestines fill up, they move forward and you see that bloating. And really, that has to be taken into consideration. And sadly, most women are not checked for a diastasis and not given proper instructions what to do about it. And if they've had a C-section, they most definitely, it's going to be weaker than if they've had a vaginal birth. So if they've had a C-section, they're going to have to mobilize that scar, and they're not going to be able to start splinting until that scar is healed, and that's usually about 6 weeks. They can do the program and hold a scarf like a little bit higher up so it doesn't impact the scar. So that's that's how it affects the body. And pregnancy is not the only cause of diastasis. Men have it and children have it because everybody's born with it. And usually around 3 years old, after the nervous system is developed, the muscles come together. But I don't say close, I say come together, because you have a weak spot at your belly button in this connective tissue. So if a child is constipated, if a child is doing gymnastics or tennis or swimming, but gymnastics is a big one.
That was mine.
Pardon me?
That was my issue, cheerleading,
So,
gymnastics, all of
so,
that.
so it's
Yoga.
a constant arching of the back and flaring of the ribs. Now, with my program, it's all about healing the connective tissue. All right. You and I are on the same page that the connective tissue needs to be healed, and nutritionally, that's very important. And I have a chart on my website that you can find under nutrition and diastasis that talks about the nutrients for healing connective tissue, the function of the nutrients, the foods that have those nutrients, and then I have developed a corrective connective tissue cream that has the nutrients for healing connective tissue. But not only that, but you have to position the connective tissue, and I'm going to give this little piece of this little plastic bag. So the big picture of my program is that I want to heal the connective tissue through, number one, positioning it. So if this is my muscle here, this hand, and this is my muscle, and this is my connective tissue in the middle, what I'm wanting to do is position the connective tissue. I want to take the stretch off the stretched out connective tissue and put it in a narrow position and keep it in a narrow position. Just like if you broke a bone, what would you do? You would put the two ends together and you would cast it, and you would continuously keep it in this position. Well, it's the same thing. We want to continuously keep this position, this connective tissue in this narrow position. All right, so the body knows it's supposed to heal in this position. We want to put the separated muscles as close together as possible, because what we've noticed is that if you have a four-finger diastasis or more and you engage the abdominal muscles, the muscles move sideways. All right, and if they move sideways, that's what? Stretching the connective tissue. We don't want to stretch the connective tissue. So when the muscles are close together, they move in the right direction, front to back. And when they move front to back, that's shortening the muscles. And when you shorten a muscle, you're strengthening it. So we're wanting to position muscles and connective tissue. We're wanting to protect the connective tissue from getting stretched, either in a forwards direction or a sideways direction. So that's about developing transverse awareness. So with our activities of daily living, the first 6 weeks, we're developing this awareness because we use this transverse muscle. The action is forwards and backwards. We use it with every breath we take and with every move we make. So we have to start being aware. When I sneeze, I hold it in. When I cough, I hold it in. When I'm going to the bathroom, I hold it in. When I stand up, I hold it in. When I sit down, when I pick up my baby, because if you don't hold it in, then it's going to be moving forward, stretching. And if we continuously stretch it, it's not going to heal. We have to limit the activities that we do. So, in week 6, when we start exercising, after we've developed transverse strength and transverse awareness in the exercise program, we're going to not want to do any activities where we're going to arch the back. So greeting to the sun in yoga would not be, if we have a diastasis, downward facing abdominals isn't good. So these type of things, we're going to have to modify the program so it's what I call diastasis safe. All right. And once we start exercising, we want a strong transverse muscle so that with every repetition, we can be engaging it. So all the power comes from the core, from the transverse muscle. So
that was my second question about exercise. All moms want to jump back into those skinny jeans and be, back exercising and doing all those things. And crunches and planks are always, the first thing of like, oh, I want to get my stomach flat again. But what you said is those exercises are just not a good idea.
But you can do planks standing against the wall.
Wonderful.
And that's the third part of the big picture of healing connective tissue: positioning, protecting, and then strengthening. So in the first 6 weeks, nobody really has transverse strength, okay? If they're just working recti muscle, they're not getting the transverse. And we really have to develop the transverse. And the transverse muscle which is the only abdominal muscle that comes all the way around the body, attaches to the recti muscle. So we have to really, so every time we're working transverse, we're going to be getting the recti also at the same time, if of course the recti are together, okay? Then it goes in the right direction. So we have these seated exercises that I call the elevator and the contracting. Now, when the muscles and the connective tissue are in that position, especially that connective tissue, when we do this isometric, these backward exercises, according to Dr. Helene Langevin, a neurologist out of Vermont, and her research on connective tissue, she talks about that these exercises, these isometric exercises, which is a backward compression, what it does is it actually creates this microcurrent in the connective tissue, and this microcurrent is what actually remodels and heals the connective tissue. So, which is why my exercises start in week 1 at 5 sets of 100 a day, working up to 20 sets of 100 in week 18 of my program. All right, so these little isometric exercises are the best thing that you can do for your connective tissue. Really the best thing. So
it was actually a yoga class with me, now that you say that, where I realized that something was not quite right. I was probably, I don't know, 14 weeks postpartum, went back and was doing some exercises, and I was like, ooh, something is not quite right. So when do moms know, how do they know when it is okay to start doing some of those things again? Is it once they know that the muscles are together?
Yes, so it's very important to know how to check yourself, and most people check themselves incorrectly. And on my website, under checking yourself for diastasis or Tupler videos, you're going to see a lot of videos on a lot of these topics in much more depth. But it's really important to know how to check yourself, to see. And when we're checking for a diastasis, we're checking the distance between the two separated muscles, or the width of the stretched out connective tissue. And we're also checking the condition of the connective tissue. So I want to see how deep my fingers can go. I have a little diastometer that measures it in centimeters and says shallow, medium, deep, and stuff like that. But the deeper you go on your finger, that your finger can go down, the weaker your connective tissue. And the whole point of the program is strengthening this weak connective tissue. All right, so that your diastasis is going to close faster if your connective tissue is shallower. All right, you're going to know that. The deeper it is, the longer it's going to take. And that's why, the best scenario would be to find out if you have a diastasis going into your pregnancy. And crunches, pregnancy is not the only cause of a diastasis. Any kind of forward force, like constipation, having a car accident, having abdominal surgery where they blow your belly up with air. So finding out before you get pregnant if you have it is the very best scenario. All right. But also doing it during your pregnancy can make it smaller. And during the pregnancy, it can actually help you with the pushing, if you know how to push with your abdominals and relax the pelvic floor. But a large diastasis can put a pregnant woman at risk for a C-section, because, as I said earlier, when the muscles separate, so if this is my uterus and this is my cervix, the cervix should be lined up with the vaginal canal. When the muscles separate and the connective tissue joining the muscle stretches sideways, what happens to the uterus? It tips forward. So now the cervix is pointing sideways instead of downwards, and you can't deliver your baby when the cervix is pointing this way. It has to be pointing this way. So keeping the diastasis as small as possible keeps the uterus in the right position.
Wow, that makes so much sense.
So it's very important during the pregnancy also to do this program. and they need to practice the pushing, abdominals, back, pelvic floor, open and relaxed, so that it's second nature when they get to the birth. Because you can't teach somebody a new skill when they're in pain.
No, absolutely not.
So
what about yoga? Are there things to avoid?
well, yoga needs to be modified. It needs to be diastasis safe.
Okay.
And the professionals that I've trained that do yoga have they modify it. Okay.
And while people are going through your program, can they be exercising at the same time, or are they doing only these exercises until they get to the other side?
Great question. First 6 weeks of the program, all right, the exercise that we tell them that they can do is walking on a treadmill, elliptical, Stairmaster, upright stationary bike, those type of activities. So the cardio exercises, no muscle strengthening, no classes, because during the first 6 weeks, we want to develop transverse muscle strength and transverse muscle awareness so that in week 6, when they exercise with the weights, they're able to use their transverse with every repetition.
Okay.
So yoga has to be modified in that most of the stuff is standing. You're not going to do those roll-ups and roll-backs because it's impossible to engage transverse. You never want to do roll-ups and roll-backs, whether you have a diastasis or don't have a diastasis, because that can create a diastasis.
Correct.
Because when the shoulders are off the floor, it's physically impossible to engage the transverse. So you don't want to. So the first one of the 4 steps of my program is getting up and getting down correctly. So when we get down, we always go from a side lying position. We get up from a side lying position. No jackknives coming straight up. When women jackknife come straight up, that can undo 3 weeks worth of work.
And I remembered hearing you say that, and I was like, wow, because what do? We crunch and we do all these exercises.
Well, crunches, and the physical therapists are actually getting on the wagon with that crunches are not such a good thing to do because they can create a diastasis and make it worse. With my program, I do what's called a head lift, all right? And it's much harder than a crunch, much harder. There's no bells and whistles, all right? But it's much more difficult to do a head lift than a crunch and I don't even put people in a back lying position until week 4 of the program, until my clients have developed transverse strength and transverse awareness. Because when you put somebody in a back lying position, and research now supports this, it's very hard to engage transverse, all right? So once we develop that transverse strength and awareness, then I put people in a back lying position in week 4.
Awesome. And I just wanted to say Julie's website and her YouTube is such a wealth of knowledge. So everyone that's interested now and has more questions can jump over to that because she really does have everything there. I mean, it's very extensive. Go ahead.
I was just going to say, and the other thing that I have is with my packages, and you can buy it individually, is I created middle of last year an ongoing online support program because this program works much better with support. So there's, in this program, it's 18 weeks, but it's ongoing. You can use it once you're registered. You can use it as long as you like. It's your home away from home. There's a weekly video. There's weekly tips. There's a blog to reach out with other people. And then I do a monthly live webinar to answer everybody's questions. So it's really,
there's a lot of
and it's at a very low cost. It's, the cost, so one-time cost of $50. And if you buy it with the package, then it's like $25.
Beautiful, because you need support in anything you're going to do. So that's wonderful.
With this program, you need support, definitely.
Wonderful. Well, thank you so much for your wisdom today and your time. I know that this information is going to help so many moms, whether they're newly postpartum or their children are older, because the greatest thing about this work is that you can close that gap, even if you have had babies 10 years ago. Right?
Yes, it doesn't matter when you've had it, when your muscles separated, or if, it just doesn't matter, or if you've had a baby or not had a baby,
right.
Because men have it also. So thank you so much for your support with the program and your willingness to spread the word, because diastasis has been kept in the dark too long, and I needed diastasis to have a place in the sun.
Absolutely. It is so common, and I'm so grateful to get some of this information out there. Thank you, Julie.
You're welcome. Bye-bye.
Bye.